Hey guys, Dr. Walk from Pinecrest Chiropractic. Let's talk through a golf injury that's so common. Golf is literally in the name. Golfer's elbow. Now, golfer's elbow and tennis elbow are almost the same thing. What they are is also known as a lateral epicondylitis or a tendinopathy. Big crazy words, but all that it means is that we're looking at the muscles on one side of the elbow, either the hair side or the non-hair side, or the flexion side or the extension side, that these muscles that move your wrist and attribute to grip all pull up and insert onto the inside of the elbow here. Now, it's common with golfers to get inflammation along the elbow, either in the tendon itself or in the bony insertion, whether inside or outside. Same thing, along the tendon there or onto the bone itself. There are two fantastic modalities we use to, one, treat this as quickly as possible, and two, get you back playing the way that you should so your game isn't affected so much. Now, the first one they use, this one's my favorite, is going to be the shockwave machine. Now, shockwave uses sound and pressure to break down scar tissue. One of the problems with this golfer's elbow is going to be the tendon part. Tendons really struggle to heal because they don't have great blood supply. And so when we use something like a shockwave, it's going to start to break down the scar tissue that's in the tendon itself and restart that healing process back from square one so it actually heals like it's supposed to. Now, what this machine feels like, it feels almost like a small jackhammer or like a TENS unit or like one of your little massage guns at home. All of those things are similar to what this feels like. It's going to be a little bit louder, and I'm going to set it up on Gavin's elbow here so you can see in just a moment what that looks like and what it sounds like as well. So traditionally, we would put some ultrasound gel here, and then Gavin, you're just going to relax just like this for me. And it's going to make a thumping noise. Now, this only lasts for a few minutes. We would go through this process 3 to 5 minutes, depending on the settings that we have it set up, to allow that to start to heal. Over the next week, then, it's actually going to start to heal like it should. So this is our first modality, and this is where we can see some really quick changes. Now, there are times where we got a deadline. We got to play now. We got things coming up. That's where we pull the laser out. So the laser is going to supplement with the shockwave as well. The laser here, this is going to use infrared light. So it's going to be light that'll penetrate through our skin 2 to 3 inches deep, depending on the settings. And this is also going to go all the way down to the level, a cellular level of the tendon specifically, and start that healing process again. It's going to increase oxygenation, circulation, and blood flow. What did we just talk about that we need to heal? Blood supply, right? So it's going to supercharge that healing process. Now, the shockwave can occasionally be a little bit uncomfortable. Think of a 2 out of 10 or a 3 out of 10 on that pain scale. It's kind of like getting a good deep tissue massage. The laser is just going to feel nice and warm from the inside out. So you can see how there's bright red light coming out of it, using that guide light to work up through this. All Gavin should feel with this is going to be warm from the inside out. Kind of like when you eat a bowl of chicken noodle soup, feel warm from the inside out. Same thing. This is going to start to take that inflammatory process and supercharge it once again. So that Gavin's out playing the way that he wants to, out having to compromise his form, out having to compromise his grip, and functioning and playing the way that he's made to in his training for. So these are 2 ways that we work on treating golfers and tennis elbows specifically. But if you want to know more about other ways we treat or how we use these modalities, come on in. Let's chat about it.